Tuberculosis, symptoms and treatment. Definition of tuberculosis. Tuberculosis is a communicable disease that results from the action of germs on the human body. The causative agent is referred to as Mycobacterium tuberculosis. It causes infection of the lungs, although, in other instances, it could affect the brain or the kidneys of the victim. The development of the disease is gradual, with only an eighth of those infected with the mild form of the disease developing secondary infection. Once infected, however, a tuberculin skin test that determines the presence of the bacterium will always be positive for the entire life of the individual. The period of progression from the primary to the secondary stage could take up to 2 years. Nevertheless, the period of reactivation could be accelerated by the presence of other critical ailments such as diabetes mellitus or HIV infection. Symptoms of the disease. Some of the most common symptoms of TB include a general feeling of sickness and weakness that is often marked by the loss of weight, rising body temperature, and heavy night sweats. Once the lung infection has set in, a rough cough accompanied by chest pains could result. For critical cases, the cough could be dotted with spots of blood. Depending on the area of infection, the above symptoms could vary from patient to patient. Spreading process. A cough or sneeze from a person infected with TB, especially in areas of the breathing system such as the lungs or throat, releases TB germs into the air. In other instances, speaking or singing could also release the germs into the atmosphere. The surrounding environment influences the duration of time taken by the germs before they die. Once a healthy person inhales this air, they acquire the TB infection. This kind of infection is referred to as a latent TB infection. It refers to a situation in which TB germs are present in a person's body but remain inactive. These people are not infected and, therefore, do not exhibit any symptoms of the disease. Moreover, there is zero chance of these people spreading the disease. At this point, a prescription of treatment from a medical professional is necessary to prevent the development of the disease in the future. It is due to this reason that persons who have spent time with a patient infected with latent TB infection do not need to be tested, as there is no risk of infection. However, spending time with someone infected with the TB disease would necessitate a test to alleviate the risk of developing the same disease in the future. TB test. In case one portrays the symptoms above, having been exposed to the TB germs, 2 tests can be applied to determine whether TB germs are present in their body. The first is the Mantoux tuberculin skin test. Under this, a small fluid known as tuberculin is injected into the lower skin section of the arm. The reaction on the arm within the next 48 or 72 hours determines the presence or absence of the TB germs. Alternatively, the QuantiFERON-TB Gold test could be applied. This test is conducted on a person's blood to evaluate one's immune reaction to the presence of the TB germs. Positive results indicate the presence of TB germs in the person's body. However, the overall disease progression cannot be assessed by these methods. A chest X-ray inspection or sputum may often be necessary for this to be determined. To reduce the chances of acquiring a TB infection, the bacillus (BCG) vaccine is administered. Nonetheless, it is vital to note that this vaccine does not completely alleviate the chances of acquiring the disease and could result in a positive TB test. For those with latent infection, the decision to kill the germs and prevent possible future development of the disease is dependent on one's chances of disease progression. People with medical complications such as HIV infections are often at a higher risk of disease progression. This is due to a weakened immune system. Treatment of TB. The known treatment for TB is the administration of drugs for a period of 1 year or 6 months. Unlike other forms of medication for other diseases, it is completely necessary that individuals complete the entire dosage prescribed. Inconsistent consumption of the drugs could result in a reinfection in the future that invalidates the first treatment process. Moreover, incorrectly taking the drugs could result in the active germs becoming resistant to treatment. Resistance of the germs to treatment complicates the treatment process and increases the costs incurred. Therefore, infected individuals should ensure they do not fall victim to either of the 2 situations. To ensure this, some hospitals assign medical staff to TB patients who ensure that the prescribed medication is followed precisely. This is termed as directly observed therapy, DOT. It is meant to help the patient recover from the disease in the quickest time possible. This will not only be beneficial to the patient but will also reduce the incidences of the disease spreading to other people in the future.